Thank you. So there are quite a number of tooth restoration procedures. And to start with the restoration procedures, you have one, a straight direct restoration, which is a filling. And the filling can either be a silver amalgam filling or a composite white filling. Then you have the indirect restoration, which means the restorations are made outside the lab or outside the practice, and they're brought into the practice and is fitted into the patient's mouth. And this kind of restorations are things like veneers, crowns, bridges. Well, tooth restoration is like the word says, restore, is to protect the tooth, the integrity of the teeth. So in situations where the tooth has been damaged due to decay or caries, when you remove the caries, there is a defect left. So a restoration will replace the defect that's left in the tooth. So the benefit of tooth restorations, one is to preserve the integrity of the tooth, to protect the tooth from damage to the nerve, and that will reduce pain. Also prevents, also helps the tooth to be in function. Is destroyed and you restore the tooth, the patient can use the tooth to eat, and also tooth restorations improve appearance of the teeth. For instance, like things like veneers, and the benefit of that is that it gives the patient confidence and improves their self-esteem. So for tooth restoration, there are a number of risks. One is the tooth can be damaged in the process where you're trying to restore, when you're designing the tooth to fit the restoration in. In cases where the tooth is still alive, the delivery of the restoration can lead to exposure of the pulp, or I mean the nerve in the tooth, and that can cause pain and sensitivity to the patient. You can also have failure of the restorations. The restorations may not last, and it might fail and the whole tooth breaks, and this might lead to extraction. So these are these are some of the risks of having tooth restoration. Well, the recovery process depends on what kind of restorations you've had. So if you have a direct restoration like a filling, you could recover within a couple of hours or 2 hours, especially if you have a composite filling which sets immediately. You can recover in less than half an hour to 2 hours, depending on if you had the treatment done with local anesthetic. If you have a direct restoration like amalgam, which is a silver restoration, it takes up to 24 hours for the restoration to set. So we do advise patients not to use that part of the mouth when the restoration is placed. Now, if you have bigger restorations like veneers or crowns, it can take 24 hours for your mouth to adjust to the new restoration. And in some cases where you have full mouth reconstruction, it can take up to 2 to 3 weeks to recover from the procedure. Well, also, like I said, it depends on why you've had the restoration, and what kind of restorations you've had. So, for instance, if it's just a direct restoration, like for a filling, after the restoration, your tooth will be back in function. There won't be any sensitivity or pain, because when the tooth has a decay, you can have sensitivity. So once that decay has been removed and the tooth has been filled with restorative material, then the tooth is back in function and you don't have any pain or sensitivity. In situations where you have veneers to improve the appearance and the shape of the teeth, of course, once you've had the restoration, you have a better appearance, your self-esteem improves, and also you have areas where you've lost the tooth, for instance, in bridges where the tooth is missing. So once you've had the restoration, you do have a tooth back in the area which is missing. You can also have implant retained restoration. So this is very useful in patients who have lost several teeth due to decay, accident, or whatever, and we can have new bridges or dentures retained on implant, and that gives function back to the patient and improves the patient's self-esteem. So to care for your teeth after a tooth restoration is not too dissimilar to caring for your teeth if you don't have restoration. So we expect you to have oral hygiene measures like brushing your teeth twice a day, the use of mouthwash to keep your gums healthy. We also advise that you see the hygienist periodically during the year to check the integrity of the restoration, to check the integrity of your health, to give you advice of how to maintain your restoration. Because if the restorations are not maintained, they will fail in the future. So there's not, like I said earlier on, whether you have a restoration or not, the oral hygiene measures are the same, and we expect patients to do that.